Hello, I'm Dr. Tan Nichols. I'm a neurosurgeon with Mayfield Brain and Spine. I would like to talk to you about spinal cord stimulators, an important treatment option for people who suffer from chronic pain. So before we talk about treatment options, we need to define what chronic pain is. Chronic pain is defined as pain that has lasted for more than 3 months. That is not a long period of time. You don't need to suffer for years and years to fit this definition. Research shows that people with chronic pain do better when they are treated earlier rather than after suffering for a prolonged period of time. This is true whether we are talking about spinal cord stimulators or other more conventional procedures. If you have suffered debilitating pain of the spine, arms, or legs for 3 months or more, you might be a candidate for a spinal cord stimulator. It works best for nerve pain, but it also can help people who suffer from arthritis, spinal stenosis, and other degenerative problems. Generally, spinal cord stimulation is reserved for people who do not improve following more structural surgeries or who are not candidates for these procedures. A spinal cord stimulator is a system that includes a pacemaker-like device that delivers mild electrical impulses to the spinal cord via wires or leads. The electrical impulses interrupt pain signals and prevent them from reaching the brain. Spinal cord stimulators have been used in the treatment of chronic pain since the 1960s, and they are continually being updated and improved to optimize patient experience and outcome. I tell patients that getting a spinal cord stimulator is like reupholstering your sofa. The sofa looks better and feels more comfortable, but I wouldn't go jumping on it. The analogy is that you feel better with the stimulator, but it's not changing your spine in any way. One of the best features of spinal cord stimulation is that you can try it out first before undergoing surgery. It's like taking a new car home for a test drive for a few days. The trial procedure lets us know whether the stimulator is likely to be effective for you. If the trial procedure reduces your pain, you can be pretty confident this permanent implant will as well. During the stimulator trial, we insert a small wire into the epidural space around the spinal cord. It is then attached at the other end to a battery unit that can be hooked to your belt or clothing like a pager. You go home after your appointment and see whether you like it. Some spinal cord stimulator devices use a low-frequency current to replace the pain sensation with a mild tingling feeling called paresthesia. Other stimulators use high-frequency or burst pulses to mask the pain with no tingling feeling. A paresthesia-free setting is an option on most devices. After 3 to 5 days of trialing, we remove the wire in the office and, with your input, we make a decision. Do we implant the system permanently, or do we try other therapeutic options? If you choose to have the stimulator system implanted, we schedule you for the procedure, which we do in an outpatient setting so that you may go home the same day. During the last 10 years, I've implanted spinal cord stimulators in more than 350 patients. Clearly, spinal cord stimulators are a time-tested option for people who feel they have exhausted their other options or feel they have reached the end of the road with their pain. People who have had multiple injections or back surgery and are still suffering should know that spinal cord stimulators can make a significant improvement in their life. If you take pain medication, the stimulator typically enables you to take less. This means an improvement in side effects with less medication. People are more able to be functional, more engaged with their families, and more able to enjoy life. If you have questions about spinal cord stimulators, or if you think you may be a candidate for one, please visit us at mayfieldclinic.com.